we really wanted an opportunity for us to begin talking about both rights and perspective and what we should be working on for the future. And so in order for us to think about this, what we thought would make sense is to talk a little bit about the past. And today's sort of framework for us to think about this is the power of advocacy. And so what's changed over the last couple hundred years in mental health? How did it get changed? And what are some of the key milestone events that changed various laws, statutes, and policies about how we do things? The goal of today is not to try to editorialize, which I'm going to try to minimize doing, but to give you a little bit of background so that this afternoon we're going to ask all of you to think about, so what is the advocacy that we should be working on for the next 3 to 5 years? What are the big issues that we should be having discussions about, thinking about, planning for, and setting up? So with that, let me start, and we've got a fairly lengthy presentation today. For those that are interested, I'm happy to make the slides available, and we can make even some of the notes available. We will be recording today's session so that we can figure out where and how we may archive it to make it more universally available. As we were putting this together, we figured that it may have useful context. So with that, let's go ahead and begin and talk about, at least in the United States, Tony, so if you advance these for me, one of the first laws, and I'm going to apologize, some of these are a little bit blurry, but the documents are quite old. And so in 1750, the King of England actually decreed in the Acts and Laws of His Majesty's English colony in Connecticut, an act relieving and ordering of idiots, impotent, distracted, and idle persons. And so that's one of the first mental health acts in the United States, the act of relieving and ordering of idiots, impotent, distracted, and idle persons. That's how it was worded. And so what this act did, it required families to care for individuals, and if no family was available, the communities to care for the individuals. And so in 1773 was the first public psychiatric hospital in the United States. This was in Williamsburg, Virginia. This is actually a historical building as part of Colonial Williamsburg. And you can actually visit this state hospital. It's not in use anymore. And so, Tony, you need to be watching Learn to Stay, because I'm not going to say it in his place. So this is what the patient rooms looked like in that early hospital. You'll note that there are shackles on the wall. There is a bed, but the bed is really a sort of comforter stuffed with straw, which was common for the time. And this was the accommodations. It's a room of about 8 foot by 8 foot. And similar to the day and times, they called these cells. Now, there were no bars on the door, although if you were what they considered a raving lunatic at the time, you would likely be chained in that facility. So if you can, guys, just make sure that we're keeping the volume down so that we pay attention to that. At the same time, the common myth is that the French psychologist Philip Pinel actually struck chains from patients who were prisoners at the Bastille. And so Pinel was the psychiatrist that actually led to the creation of moral treatment, which was considered to be a more humane style of treatment for individuals at that day and time. Now, these almshouses and the like, the early hospital changed to really focus on almshouse care. So if you remember, the King of England decreed that colonies were responsible for caring for their loved ones. From the 1780s or so up until the middle to late 1800s, what were called almshouses were the norm for where poor people or people that needed care beyond their family went. And almshouses were, in essence, a county-driven place that was for poor people who were either debtors, sometimes often called debtor prisons, or for people that were considered idiots, lunatics, impotents, or others that were problems for their family. So people were dropped off at the almshouse, and because there wasn't really care at the almshouse, many people got put in chains and shackles and were actually kept chained there for many years. The almshouses actually led to one of the first advocates in a large-scale way for the civil rights for people with psychiatric conditions, who's a woman that many know by the name of Dorothea Dix. And so Dorothea in 1841 began advocating for the establishment of publicly funded psychiatric hospitals so that people who were in distress, can you get rid of the, oh, there we go, thank you. The people that were in distress were not placed in chains and shackles and were actually treated more humanely as part of the process. And so in order for us to ensure that individuals receive the most appropriate care, Dorothea actually fought for a number of years and was responsible for creating more than 20 publicly funded psychiatric hospitals around the United States. And so as these psychiatric hospitals were founded, they began to identify needs that they had, not the least of which was training for the staff and the other people that worked there. And so in order to facilitate that training, the superintendents of the first 13 publicly funded psychiatric hospitals in the United States got together and they formed an association called the Association of Medical Superintendents of American Institutions for the Insane. This organization is the forerunner of today's American Psychiatric Association. So this is where the APA started. It started from the superintendents of state hospitals. Now, superintendents of state hospitals were not, by and large, doctors. And so one of the things that they had was there wasn't a standard treatment for how do you treat people with mental illness. There was no medical training for how you do that. At this point in time, doctors were mostly trained by being a student of another doctor. There were not the big medical colleges that we have today. And so we typically want to think about these superintendents as really being advocates for improving the quality of conditions that people were subjected to. Because if you look at the early proceedings and if you actually pulled out this document in 1855, which is the first of their sort of forming places, you can actually look at what were they talking about. So they were talking about how to get staff trained so staff would be more humane to the people that they were caring for. They were talking about what kind of environment did they need. They were talking about what did they need in order to be able to finance the hospital to cover food and clothing and the basic needs of inmates there. So this was actually established in Philadelphia, Pennsylvania, when a number of these leaders came together. Now, just a sidebar and note about this time, shortly thereafter, the Civil War started. And I'm going to come back to that because the Civil War and the end of the Civil War changed dramatically how psychiatric institutions were staffed and who ran them. So the next sort of venture is an interesting one, which actually started in Europe, which is the creation of one of the earliest peer-run programs, which is the Alleged Lunatics Friends Society. And so when we think about what's happening at the day, in London, England, a group of alleged lunatics and their friends got together to create a group that lasted until 1863. So for about 18 years, this group advocated for reforms in mental health care and treatment. So it was peers, family members, and their friends began advocating for changes in the system. And so the article of the day that was written, is this advocacy or is it folly? And so it remained to be seen whether alleged lunatics could be real advocates for change in a positive, meaningful way. And so one of the first in the United States advocates to actually change laws and legislation, curiously enough, is another female. So like Dorothea Dix, there's a woman that many don't hear about, a woman named Elizabeth Packwood. In 1863, Packard, I don't know why I always say Packwood. In 1863, Elizabeth was hospitalized in the Illinois State Hospital for the Insane in Jacksonville, Illinois, and she was hospitalized because she disagreed with her husband about slavery. She opposed slavery. Her husband supported slavery, so he said that she must be a mad woman and had her hospitalized against her will. So Elizabeth Packard actually then wrote a series of pamphlets and published them herself to advocate for change, so that no longer could spouses have their wives or partners institutionalized. She actually went to the Illinois State Legislature in 1873, and in this book carving, which you'll see in just a moment, Elizabeth actually addresses the Illinois legislature to lobby for dramatic changes in civil commitment laws. And this is actually the first time there were laws created, at least in the United States, around civil commitment, because before this, basically anyone could drop anyone off at the asylum and they'd be taken in and taken care of if they didn't have anyone else to foster them. So Elizabeth Packard made a change in that by petitioning the Illinois government to say that no longer could your husband, and predominantly we're talking about husbands because of the nature of the day, no longer could your husband have you hospitalized because he disagreed, in this case, with their political viewpoints. She had a number of things she was concerned about, how her children were raised, but equally important, she opposed slavery and her husband promoted slavery. And so Elizabeth made huge difference in that piece of legislation. Now, at this time, the Civil War was ending. And when the Civil War ended, one of the things that happened was the best political job of the day was the superintendent of a state hospital. Why? Because you got a mansion to live in. You got staff to work for you. You got servants to assist you. And you ran a large institution that government decided should be run by experts who were experts in running it. So what happened when the Civil War ended? Union Army commanders were put in charge of state psychiatric hospitals. Now, before they were put in charge, most state psychiatric hospitals, and we have a number of pictures of them here in New York even, had regular festivals on Saturdays and Sundays where patients and staff got together and recreated. When the Union commanders came in, the first thing they did was put a stop to that. Why? Because in the military, enlisted personnel don't ever fraternize with officers. And so that was against the military code of conduct. The superintendents also put the staff in uniform. Why? Because in the military, you know who people are by the uniform that they wear and the rank on their sleeve. So this is the first instance where doctors' white coats became the uniform for physicians. And the typical uniform for nurses came about, and for hospital attendants came about, much in the way the military was regimented by rank and by class. Curiously enough, we had just won the Civil War, and the Union commanders segregated what were previously integrated state hospitals. Hospitals historically had been integrated by race and by sex prior to the winning of the Civil War. And what happened in 1875, the first hospital for the colored insane, and that was the words of the day, was established in North Carolina by the General Assembly at a cost of $10,000 to build the hospital. Many of the early hospitals for the colored insane were actually built by the patients of the hospital themselves, as were many state hospitals in general. And so unlike today, where patients are considered too sick to work, at this point in time, every patient worked. Now, curiously enough, at the same period of time, this is a picture of the female patients in North Carolina in 1918 actually picking cotton in the fields. During this time, patients all worked. Now, this was before the advent of major psychotropic drugs. It was expected that every patient worked, no matter how sick you were. And in a report to the governor of New York State, Governor Clinton, who's most noted for building the Erie Canal, a gentleman who he tasked with looking at all the state hospitals in New York State, wrote, "Of all the modes maniacs use to maintain themselves, regular employment seems to be the most effective." This was written in 1817. We've known for almost 200 years that employment actually has huge therapeutic value for individuals. Now, we stopped having people do this kind of labor in our hospitals because the Supreme Court decided in around 1931 that to have patient labor work was equivalent to slavery unless we could pay people to work. Now, the reason they decided that was not because they were against patients working or that they really believed that it was slavery, although one would argue that it actually is slavery, but because the stock market had crashed in 1929 and society needed jobs for able-bodied men. And so we needed to take the jobs away from patients and give them to able-bodied men because we needed able-bodied men in the United States to be able to work.
It has come full circle now. In developmental disabilities, people work and they get a stipend. You know.
And so,
isn't it interesting how?
When we think about employment for people with mental illness, this was before modern psychotropic meds and before many of the advances that we have today. In 1878, a New York woman became the first head of the New York State Board of Charities and Corrections. And she established in New York State the Newark Custodial Asylum for Feeble-Minded Women. And this happened in 1878. So Josephine Shaw Lowell was the commissioner, basically, of mental health and corrections. She ran the almshouses of the day and actually established that place for feeble-bodied women. Now, not all of the history of mental health is about positive changes. There are a number of dark moments in our history. And the next individual actually has good and bad associated with him. Sir Francis Galton is noted for establishing the concept of nature versus nurture. So how much of mental illness is caused by genetic predisposition versus how much of it is environmentally caused by nurture that we get or lack of nurture that we get. But he was also instrumental in eugenics. And eugenics is the study of, in some ways, the pseudoscience of improving the races. And so this was later used by the Germans and others to eliminate racial impurity in a number of settings. Curiously, in 1883, Sir Francis Galton's work also led to the passage of the Jim Crow laws in the South, which were designed to affect immigration by Eastern Europeans, mostly Asians, Africans, and Jews, so that we did not change the racial purity of the racial Southerners. The Jim Crow laws were created to restrict those kinds of things. A little bit later, New York did something which was actually one of the early states to do this in a wholesale way. New York in 1890 passed what was called the State Care Act. And the State Care Act created for the first time public psychiatric hospitals and public hospitals for people to go to, rather than being in almshouses which were left to local government to figure out could we pay for them or not. Did we decide to pay for food for people or not? And depending on how the local economy was, sometimes we didn't feed people so well and they starved to death. Sometimes we didn't treat people so well because of local politics and local finances. And so in 1890, the State Care Act established the state's responsibility for mental health services in New York State. Now, it was about this time that a number of other leaders came forward in terms of advocating for care and treatment. Now, remember, these people are advocating not for the large hospitals that we have today, but for what was at the time considered the most humane and appropriate treatment that we could give to people of the day. And so one of the people that is most noted today, in 1896, William Pryor Letchworth became an advocate for what was called the feeble-minded, epileptic, and the, as he called it, the unfortunate classes. And so Letchworth established what was then called the Craig Colony for Epileptic, easy for me to say, epileptics in 1896, and the Letchworth Village for the feeble-minded and epileptics was later named for his honor, which later became the Letchworth Village, which has long since been closed. What he advocated for at the time, and this will sound very similar to things that we talk about today, he advocated for spacious grounds, for a home-like environment, for adequate medical staff, and equally important, and I'm going to quote from him, vocational and educational opportunities for residents. Doesn't that sound like things we talk about today? And so he was pretty progressive at the time, although Letchworth Village later became a symbol in a lot of ways of problems in the New York State system, which was partly why it was closed. One of the principles that fundamentally changed mental health care actually didn't come along until the 1900s. And his book, entitled The Interpretation of Dreams, dramatically created a branch of psychiatry that is known today in terms of analytic psychiatry. So Sigmund Freud actually wrote The Interpretation of Dreams, and Sigmund's sort of premise was that all of the human psyche was actually contained in the unconscious, so that if you interpreted people's brains when they weren't consciously thinking about them, you could figure out what was going on for them. Now, we don't use a lot of this thought today, but it really did expand the thinking of treatment of the day to start thinking about, so what could we understand about people and how might we use that to change how people are treated and served. From a consumer and family advocacy standpoint, more important than Freud is the next gentleman who was a psychiatric patient himself. Clifford Beers, who was an inpatient in psychiatric settings, wrote a book entitled A Mind That Found Itself. Clifford Beers is considered the father of the Mental Health Association in the United States. It was as a result of Clifford Beers' work that radical reform around hospitals began to take place. And he called his early movement the mental hygiene movement, which were the terms for the day, and he actually established that movement that flourished until after his death. Again, not such a good part in our history, but to highlight the problems associated with various schools of thought at various points in time. Dr. Bernard Sachs is noted for his treatise on nervous disorders of children. And Dr. Sachs is most noted for his recommendations that children who masturbate be treated with cautery to the spine and genitals. And to cauterize is to burn, sear, or destroy. And his premise was that that would in fact cure the mental diseases of children. And so we've since changed exponentially from there, but certainly in a lot of ways maybe still seen as causing harm in a variety of ways. Now, I talked about Clifford Beers starting the mental hygiene movement. In 1909, he started what was called the Committee for Mental Hygiene, and he started this in New York City. If you're familiar with the Mental Health Association's logo, the Mental Health Association's logo is a bell. And you'll see this bell in the upper left-hand corner of this slide. That bell was actually crafted from the chains and shackles that were used to bind psychiatric patients. And so in 1950, Clifford Beers called for state hospitals to send all their chains and shackles to him. And in 1950, they were melted down in this smelting. And you can see, in this case, this is Governor Theodore McKeldin from Maryland actually putting the leg shackle, and you can see it on this long poker, in the smelting pot to literally melt it. The bell, which is the symbol of the Mental Health Association, was forged from the melting of these chains and shackles, and it was designed to be a replica of the Liberty Bell in Philadelphia. It is a real bell. It regularly travels around the country to local mental health associations to ring in a variety of events. And so when you see it, I want you to be reminded of the advocacy against forced treatment and restraint and seclusion that's been going on for more than 100 years for the elimination of chains and shackles as an inhumane treatment. One of the pivotal events in terms of modern advocacy is the creation in 1920 of the United States Office of Vocational Rehabilitation. For the first time, this office was established to focus on rehabilitating people that were disabled. Now, there's a timing event that's critical for this. 1920 happens to be after World War I. And a number of individuals from World War I were disabled as a result of the war. And so the Vocational Rehabilitation Office was established to rehabilitate individuals who became disabled. In the early years, it did not focus on people that were born or developed disabilities by virtue of lack of a better word, naturally, or were born that way or developed them, but mostly for people who acquired disabilities as a result of service for the United States government, mostly in military affairs. But that was a good thing for us because it created the premise that people with disabilities could in fact work, which later set the frame for other advocacy movements, including peers and families, to begin advocating for a change in that. So I said earlier that the Association of Medical Superintendents for American Institutions for the Insane, AMSI, became the American Psychiatric Association in 1921. And so this was not an association of doctors or medical professionals. As I said, the early mental health superintendents were actually military soldiers, military commanders after the end of the Civil War. But the APA became the advocacy arm for hospitals and later for psychiatrists as associated with those hospitals and the facilities. Now, again, there's good and bad in our history and in the advocacy. So one of the early advocates for change, we talked about eugenics, and one of the saddest periods in our time actually began in 1924. The Commonwealth of Virginia passed a law that allowed for sterilization without consent of individuals found to be feeble-minded, insane, depressed, mentally handicapped, epileptic, or other. Alcoholics, criminals, and drug addicts were also sterilized beginning in 1927. And the premise here was that we did not want the feeble-minded to be procreating, because that would make all of us as a society less intelligent. So they were too incapable of managing their own sexuality, so they had to be forcibly castrated or sterilized. And so that continued to happen up through the 1970s. And if you look at the laws of the day, more than 60,000 people were sterilized without consent. It's a huge set of numbers. Now, one of the things that perpetuated this, and so you heard one of our speakers from the various groups when we were doing the report outs talk about the legal process. The legal process does not always work in our favor, and sometimes it's worked against us in a variety of ways. And so in 1927, there was a United States Supreme Court decision in the case of Buck v. Bell, Buck versus Bell. And so two Buck women, Carrie Buck and Emma Buck, sued the United States government that they not be forcibly sterilized. And in the Supreme Court decision, which was voted 8-1, it legitimized Virginia's laws on sterilization. That was not repealed until 1974. So that's how long these laws had lasted, up until 1974. This case was ultimately written by Justice Oliver Wendell Holmes, who said, and I quote, "3 generations of imbeciles are enough." That was a quote from the majority opinion in the United States Supreme Court. And so advocates like the Bucks tried to change the system using both legal means and others to think about ways that we could improve the quality of life for many of us. Now, one of the fundamental changes in the United States, which has forever since changed the quality of life for individuals who are older and now individuals who are disabled, is the 1935 passage of the Social Security Act. FDR signed this act to establish federally funded old age benefits and to fund states to provide assistance to individuals who were blind and disabled. Now, why did they specify blindness specifically? Well, the reason's really simple. In 1935, the Lighthouses for the Blind were the leading lobby for people who were disabled in the United States and the only organized body on Capitol Hill that was testifying as these laws were considered. And so within the Social Security Act and within SSI and SSDI today, there exist blindness exemptions which provide a different set of slightly different benefits and rules for individuals that are blind, that are different from all other disabilities. And it's a result of that advocacy of the early blind organizations. Now, we talked about Sir Francis Galt, and we talked about the eugenics laws in the United States. Often people think about Hitler's final solution being conceived of by Hitler. Hitler actually patterned the final solution after the United States Virginia laws. And he actually gave the Virginia professor who created the statute an honorary degree from the University of Heidelberg in Germany prior to the outbreak of the war. Now, Hitler perfected eugenics in a way by something called action, the T4 experiments, or the T4 solutions, in which the psychiatrist of the day, the psychiatrist in Germany, began advocating that we create mercy killings for individuals that are biologically unfit. These were the doctors of the day. And so Hitler's final solution was actually crafted by physicians who first perfected it on the biologically unfit, people with disabilities who were institutionalized. They called them bottom feeders and people who were taking from society, not giving to society. During the Nazi regime, more than 270,000 patients with mental illness were killed by physicians and medical personnel who complied with the Nazi doctrine.
So that was in Germany then?
It was in Nazi Germany.
Okay.
Now, the Nazi government had codenamed this for racial purity and later expanded it to include the Jews after practicing on the gypsies for a variety of political reasons. Many of the early people advocated, and during that time is the poem that was created, when they came for the disabled, I didn't say anything. And when they came for the gypsies, I didn't say anything. And when they came for the Jews, I didn't say anything. And when they came for me, there was no one left to say anything for me. And so it was really about speaking out. At the same time, the Catholic Church, in a weird backward alliance with the German government to prevent them from taking over the Vatican, sanctioned what Germany was doing. So in 1945, we have the President's Committee in the United States. Down your wrong slide. The President's Committee on Employment of the Handicapped. Slide number 26.
No, it's just we're on two different computers.
Okay. And so the President's Committee on Employment of the Handicapped was the first time the President of the United States created a task force to look at how do we help people with disabilities get employed. Now, if you remember 1945, what was going on then?
World War II.
World War II. So part of the reason that we were looking at helping people get employed was in part because of many of the individuals that had come back from World War II were in fact disabled by war. And again, this was a focus on helping individuals achieve broader employment in that regard. We've talked about advocacy from a number of standpoints, both state hospital superintendents, staff, outside advocates, women, and organizations.
The system has detected that a minimum
And
number of
one of the first broad-based advocacy organizations actually occurred in 1946. In 1946, what happened were conscientious objectors, individuals who objected to going to war for religious and other reasons, were actually required to work in state psychiatric hospitals. The conditions that they found in the state psychiatric hospitals so appalled them that they actually created a society for themselves called the National Mental Health Foundation. This group of advocates who were made up of patients actually began advocating for better training for staff so that they wouldn't abuse patients, that they could actually be helpful. Ways to actually educate the workforce so that instead of abusing patients, we could actually provide more humane care. Now think about it. These were conscientious objectors who objected to war based on their religious convictions, and so it's not surprising that their religious convictions brought them to object to the abusive and coercive treatment inside psychiatric hospitals of today. Now, their advocacy resulted in the foundation of the National Institute on Mental Health that President Truman signed in 1946. And I'll talk a little bit more about that next, because it really is that signing that created the first branch of government to do research and to finance the education of the staff that worked in mental health treatment facilities across the United States, so that we could begin the end of the abuses and coercion that had existed during the attendance care. And so they fought valiantly for the establishment of this, which created more funding to actually train staff better, to be more humane. It was during this time, after the end of the war, that many of the staff actually brought examples of abuses to the newspapers, and newspapers continued to publish stories about the atrocities in the psychiatric hospitals through the 1950s. And so if you look at historical newspapers, you'll find many accounts of abuse, overcrowding, neglect in psychiatric hospitals as a result of the staff bringing those issues forward to the newspapers, because they were as appalled as anyone about how they were forced to care for people that were left in their custody. Well, during this time, curiously enough, a group of peers, recipients of services, got together in New York City. They had been incarcerated at the Rockland State Psychiatric Hospital, and they formed a group called WANA, We Are Not Alone. And they organized on the steps of the New York City Public Library and began meeting to how they could facilitate each other and provide peer support for themselves and others. And so you'll see this letter is from Orleans, who was the president at the time, to Robert Allback, who had just visited and provided the executive committee of WANA with support. And so you'll notice that WANA has a medical advisory board, and the doctor from Rockland Psychiatric Hospital is one of their first advocates, helping them, advise them on how they can support each other. WANA actually became the foundation for another organization that we'll talk about in just a minute. As a result of the end of World War II, another major change happened to provide better services for people with psychiatric disabilities as a result not of our own activity, but of advocacy for veterans. So returning veterans who were returning from the war found that many were in fact permanently or considered totally disabled. And so President Truman signed into law in 1950 the Social Security amendments, which created the state federal program to aid those who were permanently and totally disabled, leading to SSI and SSDI today. That's kind of the forerunner for those kinds of services. At the same time, Truman appointed another woman, and so you'll see that there are many women who were instrumental advocates of the day. Mary Switzer, who was appointed to the director of the Office of Vocational Rehabilitation. So Mary's great contribution here was she wrote for the first time a Bill of Rights for the handicapped, which is often referred to as the Magna Carta for people who are handicapped, and she created what was called the Social and Rehabilitation Services in the Office of Health, Education, and Welfare. So in 1954, she instrumentally shaped what was called the Vocational Rehabilitation Act, which provided state federal program for the blind, including blind workshops and the carve-out for blind industries, and actually passed a number of federal grants to provide services to university-based and other rehab-type programs around the United States. She actually funded more than 100 programs across the country from a grant-based funding that she single-handedly created. Now, we often talk about the DSM, and you heard Lauren Tenney talk about the issues and the desire from some to protest the DSM-5. The DSM was originally created to make a shorthand, if you will, in part for insurance. It was a way to establish a common nomenclature to talk about what had been heretofore been seen as a variety of different kind of illnesses. And in fact, in the first published edition in 1952, there were 112 mental disorders. In that edition, for the first time, it established homosexuality as a mentally diagnosed disease. And so if you think about what was happening in the 50s, that became part of the discussion in the 1950s. One of the most fundamental changes in mental health care and treatment is really the creation and the FDA's approval of a new drug in 1954 called Thorazine. Many patients call them one of the Zine sisters. We know Thora and Stella, and many of you have been in an inpatient setting have seen the use of them. At the time, these were the first drugs, arguably, to treat a mental health condition. And it was the advent of these drugs that contributed to the deinstitutionalization of people. Because prior to this, individuals were hospitalized until they sporadically recovered. With the introduction of Thorazine, people began to be discharged more from state psychiatric hospitals as a result of receiving drug therapy, which forever changed the way that we viewed mental health treatment. And so often it's considered that you have to be on drugs to get discharged. Prior to 1954, people were discharged without drugs because there were no drugs. Since 1954, it's become the gold standard, if you will. Now, something also happened in 1954 which began changing advocacy in general. And so I'll talk more about this at several different points in time. But Brown versus Board of Ed came about, and so Brown versus Board of Ed was a Supreme Court decision from Topeka that ruled that separate schools for black and white children are constitutionally unequal. So we used to have the doctrine of separate but equal. Supreme Court said segregation constitutionally is unequal by virtue of segregation, and therefore this became the catalyst for the civil rights movement. The civil rights movement itself is often credited as the beginning of a variety of rights movements, including Great Panthers for the older persons, and the mental health civil rights movement, which some of the pivotal leaders I'll show you in just a few minutes. And so this was one of the key decision-making points of the day. Now, in 1955, a year after this, psychiatric hospital treatment peaked. And it peaked at a rate of 550,000 inmates across the United States were part of psychiatric hospitals. If you can't see the picture here, these are ice baths. And it was considered a treatment of the day to put someone in a bath full of ice water that would calm the nerves or soothe psychotic conditions. Wet sheet packs were also typically applied as a therapeutic, quote, measure. And individuals regularly would be strapped down, and you can see the straps in the forefront here of the gentleman who's in a deep bath, and you can see the ice cubes floating in there. This lowers the body temperature to a critical point that we know that causes other issues medically now. But this was considered state-of-the-art treatment of the day. And so as we've changed years, what's considered state-of-the-art sometimes becomes barbaric when we look about it in retrospect. 550,000 inmates. Now also in 1955, one of the first patient uprising happened by a 19-year-old African-American man who was hospitalized in Texas. His name was Ben Riley. And their uprising called for demands for better counseling, organized exercise periods, and an end to prisoner beating. He said that all inmates should have the same rights enjoyed by white inmates regarding meals, bathing, and freedom of movement. And that became one of the first sort of cases that said about rights for inmates, which then also translated for rights for inmates in other institutional settings. Now, as people began advocating during this time, groups of people also began advocating for disabled workers' benefits. And so in 1956, SSDI, Social Security Disability Insurance, was passed, adding SSDI as a benefit to the Social Security benefits. Now, when SSDI was passed, it was originally only passed for individuals between the ages of 50 and 64 years old. It was later amended in 1958 to cover benefits to dependents of disabled workers. So if you were a child of someone who was disabled, you could get benefits. And in 1960, the restriction on age was eliminated so that all individuals who were disabled were available to take advantage of SSDI. Now, we often cite President Kennedy for a number of great works, and many people consider him the father, if you will, of community deinstitutionalization. But I want you to remember that it actually started in 1955 after Thorazine was introduced, and state hospitals peaked in 1955. Ever since 1955, state hospitals have been reducing the number of people across the country who are institutionalized. To now, I believe nationwide we have less than 50,000 people in psychiatric hospitals anywhere in the country. So we're at less than a tenth of where we were several decades ago. So in 1963, President Kennedy signed the Mental Health Centers Act. And this was an act that actually created for the funding of community health centers. And his rationale was not based on mental health care and conditioning. His rationale was based on his experience as a PT warboat pilot in World War II, where he saw that the MASH hospitals, the mobile treatment hospitals, had the best effect for people, treating them closest to where they lived and worked and returning them back to their units, if you will. And so his vision was that we could do the same thing with mental health care and treatment, that people should be served closest to the communities that they live in to more rapidly return them to community care. Now, unfortunately, the act was never fully funded and financed. And so that the promise of the Community Mental Health Center Act that Kennedy visioned was never fully realized. But in 1963, he also signed a second bill called the Mental Retardation Facilities and Community Health Center Construction Act, which actually financed many of the DD and mental health centers in the early years that existed in the United States. It funded the building of those. Now, I said that civil rights played a key role in terms of advocacy and the advocacy movement, including the family and peer movements. And so I would be remiss if I didn't talk about the 1964 Civil Rights Act that Lyndon Johnson signed. And he prohibited in the act the basis of discrimination on race, religion, ethnicity, national origin, and creed. Later, gender and disability were added as protected classes, but the original act in 1964 was race, religion, ethnicity, national origin, and creed. Interesting to note, we've talked about, and I've presented to you before, the problem that we have with women losing custody of their children by virtue of mental health conditions. In 1963, out of 1,000 mental patients, 23 out of 1,000 were unmarried mothers. The reason for being hospitalized was they were pregnant. Unmarried mothers hospitalized because they were pregnant. And so it kind of, if you think about it, is a natural leap from the early eugenics laws and clauses. In 63, you'd never get pregnant without being married. And so one of the things that happened. 1965 created a couple of things which exist to this day to be the major financing of health care in this country. In 1965, they were not considered the financing, but were actually created by President Johnson to help southern states. And they were really created to help the southern states that had a problem paying for care for the poor. Hospitals at the time did not want Medicaid. They did not care for it, and they did not want Medicare. Today, there's not a hospital in the United States that does not accept Medicaid. And it is the major financing for hospitals in the United States. But in 1965, that's not what they were advocating for. They wanted private payer systems to still exist, and yet today, universal health care began its roots with Medicaid and Medicare, which began in 1965. Now, they set a standard for Medicaid and Medicare of you had to be disabled for 12 months or more. The standard and the reason for setting that standard, many of you have heard me say this when we've done the Social Security training, is because Congress, in its infinite wisdom, did not want pregnancy to be considered a disability ever. And so Congress decided that if they set the standard at 12 months, pregnancy could never be considered a disability because no woman could last biologically 12 months till they came to term. In 1972, the Architectural Barriers Act was passed, and this prohibited federal construction from being inaccessible. Now, the rules have changed at various points in time because the Federal Architectural Advisory Board, and this was one of the earliest federal statutes around disability rights for generic access, and so it's the Architectural Barriers Act. Now, I'm getting closer to the modern day, and I'm going to try to go through these quicker because I've spent more time on the history. So we've got probably, for those of you that get antsy around noon, we're going to go past that to get through laying out the framework for these discussions.
Lunch isn't scheduled till 12:30, so we're good.
I know, but people get antsy around noon still. So, with that said, one of the earliest patient leaders in terms of advocacy was someone who you've heard referred to of the drop-in center in New York City, Howie the Harp. Howie the Harp, or Howard Geld is his real name, was known as the Harp because when he lived on the streets, he played a harmonica. A harmonica is considered a mouth harp. And so people on the streets called him the Harp because you'd never see Howie without his harmonica. And so Howie actually began in 1969 a program called the Insane Liberation Front. And Howie was a homeless advocate, and he began this actually in Portland, Oregon, where he was living at the time. He bounced around the country and found himself in Portland. He started the Insane Liberation Front, and he patterned it, for those that knew Howie personally. Howie and I spent a lot of time talking about how he came to some of these things. He patterned it after the Civil Rights Movement. And I'll show you a couple of the things that he actually focused on. His early movement was patterned after other things that were happening at the time. And so the Harp actually used a lot of the pattern for his advocacy agenda based on the Civil Rights Movement and what was happening at the day and the time, which was the gay rights movement. The Stonewall Inn riots in 1969 happened in Greenwich Village, New York, and this was a result of the police going in and cracking down on gays and individuals who were in their minds cross-dressing. They had female officers take anyone in a dress into the ladies' room, and pull down your dress, and if you had male genitalia, you were arrested. So the gay advocates protested. And you can see some of the signs of the day, and they actually began to change the statutes and the laws of the day. So the HARP patterned this change of laws based on both the civil rights and the gay rights movement at the time. Equally at the time, and patterning along the same lines, is a gentleman from California who's considered the father of the independent living center movement. Ed Roberts was a quadriplegic, confined in a wheelchair. And in 1970, he created a group called the Rolling Quads. Ed's stance was, I'm not too disabled to work, and yet everyone told him because he was a quadriplegic that he could never work. Ed was actually appointed to head the Vocational Rehabilitation Center in California, and this is his day with Governor Jerry Brown at the time, who signed into law California, which created the first centers for independent living as a result of, Ed's advocacy efforts. This gets somewhat emotional for me personally because many of these people I had the great fortune to know and have discussions with over the time. And so putting this together brought back a lot of memories of people who we've lost because many of these people have since died. In 1970, the gay rights activists stormed the APA meeting in California and began a dialogue to change the diagnosis of homosexuality that ultimately had it eliminated from the DSM. But the APA was actually meeting in, of all places, San Francisco, California, and the Gay Liberation Day was proclaimed and actually stormed the APA meeting to begin making a change in the way the APA organized itself around diagnostic criteria. In a similar venue, and this is rather curious, we use Mad Pride today in some of the advocacy organizations, but in the 1970s in Europe, actually a union was created, much like the labor unions and others. This was a union, but to join the union you had to be a mental patient. And so it was the Mental Patients Union and the Community Organization for Psychiatric Emergencies, abbreviated COPE. These were people who had been inpatients, and they organized a union to protect their rights, mostly about emergency treatment. They wanted to receive treatment of their choosing, not to be taken in chains and shackles to a hospital. And so they began thinking about how can we do this, and they thought that the union structure would be the way that would give them some civil rights, because unions at that time were kind of at the height of union organizing around the globe. One of the earliest Supreme Court positive civil rights decision was a decision that came out of Tuscaloosa, Alabama, Wyatt versus Stickney. And this is Ricky Wyatt. Ricky Wyatt, when he was 15 years old, was kind of a runaway and doing bad things. His family took him to the psychiatric hospital and left him there. He became an inpatient, not because he had a diagnosis, but because his family didn't know what else to do with him. Ricky sued the state of Alabama, and in a case that went all the way to the Supreme Court, the case was decided that disabled people could not be locked away in custodial care anymore without treatment or education. Wyatt versus Stickney became the first civil rights law that required if you were hospitalized and locked away, you had to be given care, treatment, and education. That care alone was no longer sufficient. And so that's the basis for a lot of our civil rights laws today, that the right to treatment is a right that people absolutely have as a result of the 71 Wyatt versus Stickney decision. Now, that decision, the right to treatment, has morphed over the years to treatment and rehabilitation in the least restrictive environments. And Ricky and his lawyers advocated that the Wyatt decision should actually extend that people shouldn't be institutionalized simply because he was having trouble in school and his aunt didn't know what to do with him, but that he should have gotten care in the community as a 15-year-old. And you saw Ricky when he was actually in his 50s. He died, I think, at age 55, which, again, we talk about the 25 years lost life, 25 years lost life. There were other decisions that came out, the co-consent decree, United States versus Solomon, Welsh versus Lincolns in Minnesota, that resulted in what later became the establishment of PAMI, the Protection and Advocacy for Individuals with Mental Illness, and I'll talk about that in just a minute. But this was a 15-year-old advocating for his civil rights that created the right for legal representation and treatment in the least restrictive setting. In 1971, Howie the Harp and the Mental Patients Liberation Project in New York City. So Howie's now gone from Portland, moved back to New York City, living on the streets there, founded the Mental Patients Liberation Project, and they wrote a Mental Patients Bill of Rights for the first time. And the basic rights were you have the right to be treated like, so you have to keep moving. The right not to be treated like a criminal, and the right not to be experimented upon. Critical rights that we consider rights still to this day. Also in 1971, and in a lot of ways, clinicians see him as the father of a lot of treatment. Most notably, he was the founder of something called the Schizophrenia Bulletin, is Dr. Loren Mosier. Dr. Loren Mosier was the head of NIMH Research Institute for Schizophrenia for a number of years. He was considered at the time the leading expert on schizophrenia. Loren was a great advocate for not institutional care, but for alternatives to institutional care, most notably a project that he started in California, in San Francisco, called the Soteria House. And the Soteria Project actually documented some great therapeutic benefits of serving people in community-like settings with small numbers of people working together on common grounds. The Soteria Project ended in 1983, and I'm sorry to say that Loren passed away. He was a great advocate for peer and family support as well. Loren was my first contract manager for the first public drop-in center that I ran in outside of Washington, D.C. Loren had gone back to NIMH and actually had the opportunity to work with he and his wife for a number of years before he moved away. In 1972, another set of changes happened. The Network Against Psychiatric Assault, NAPA, was organized in San Francisco, mostly organized around abuses in psychiatric centers. The Mental Patients Alliance in Central New York was established. So for those of you in Central New York, know Carol Hayes Collier was instrumental in getting that started in 1972. The Judge David L. Bazelon Center for Mental Health Law was established in Washington, D.C. to advocate for the legal rights for people with psychiatric illnesses. And last but not least, was Social Security established, SSI, in 1972 to help families and relieve families of the burden for caring for disabled adult children. So this is SSI was established. Equally in 72, we have a number of things that happen like Madness News Network, which is a publication by patients and for patients. And you'll notice the time they're really talking about how to help people who are being discharged. Dangerous psychiatrist release, a euphemism for some of the language of the day that still exists today when we talk about dangerousness of people who are receiving treatment in a variety of settings. 1972 also brought about a landmark case that was brought by a psychiatrist of all people, Dr. Gunnar DeBald, who was an advocate in the Pennsylvania Association for Retarded Citizens. He sued the state of Pennsylvania through PARC, the Pennsylvania Association for Retarded Citizens, and established the right for children with disabilities to have access to a free and equal public education That's where the free and equal public education laws in the United States came from. There was one psychiatrist working with the ARC in Pennsylvania, creating the statute, ultimately the law that created the statute. That went all the way to the Supreme Court, Park versus State of Pennsylvania. 1973 passed the Rehabilitation Act, and the Rehabilitation Act, which actually wasn't passed until 74 with amendments, actually became the basis for the Americans with Disabilities Act. The Rehabilitation Act basically said it was illegal in federal programs to discriminate on the basis of disability. And it became the basis for a lot of laws and statutes that we use today, including the Americans with Disabilities Act. Most people think the ADA applies to everyone. It does not apply to federal programs. And the reason it doesn't apply to federal programs is the Rehab Act already applied to federal programs. So the Rehab Act created a basis for which people with disabilities had rights in federal programs, and that the Act calls no otherwise qualified handicapped individual in the United States shall, by sole reason of his handicap, be excluded from participation in, be denied the benefits of, or be subjected to discrimination under any program or activity receiving federal financial assistance. Huge change in the law. But not all programs receive federal assistance, which was the reason we needed the ADA, which came about years later. A number of other things happened about this time. The National Gay Task Force got the APA to change the diagnosis of homosexuality as a disease to where it was only considered a disease if it was troubling for the individual that had it. Lesbian Nation was a book that was written, again, more about gay rights, but a lot of the rights issues became the basis for a lot of the family and patient rights issues in mental health. In 1974, a group of advocates from the Network Against Psychiatric Assault actually smuggled into state hospitals a set of cameras and began filming a documentary of the ward conditions in violation of federal laws in psychiatric hospitals. This group of advocates put together a film called Hurry Tomorrow. The premise of the film was, hurry up tomorrow because I hope it's better than today. And they screened that film in San Francisco at the Clay Theater and began screening it and using it as a cry to say treatment in our psychiatric hospitals was brutal and horrible at the time. That film and the advocacy that it did ultimately resulted in a change of law that I'll talk about in just a minute. But many people are unaware that documentaries like this became the basis for changing statute because it showed the American public that not all was what they were being told that it was like. And so, based on the Park decision, remember the Pennsylvania ARC decision about free and appropriate public education? In 1975, the Education of All Handicapped Children, Public Law 94-142, was created, which called for the free and appropriate education in the least restrictive environment possible for all children with disabilities. This law is now called the Individuals with Disabilities Education Act, IDEA, but this was the basis, and remember that law came out as a result of the ARC advocacy in Pennsylvania. Now, other laws that have come about in 1975, the Developmental Disabilities Assistance and Bill of Rights was established. This bill created the legal right to legal representation for people with developmental disabilities. It created their protection and advocacy system for developmental disabilities. People with mental health rights didn't get that until a few years later, but the DD statute actually created the basis for which that came about. Now, in 1975, a group of patients actually took a court case all the way to the Supreme Court in a case of O'Connor versus Donaldson. And the Supreme Court, this is the Supreme Court chamber inside, decided that it was against the law in the United States to involuntarily institutionalize anyone against their will unless they were considered to be a threat or danger to themselves or others. This is the basis by which all civil commitment laws in the United States are now patterned after, because in order to be admitted to any psychiatric hospital involuntarily, you have to be considered a threat or danger to yourself or others, which is the basis of O'Connor versus Donaldson. In the late 70s, something really radical began to happen which forever changed the basis of advocacy in the United States. The National Institute of Health began a program called the Community Support Program Section. Heading it were two people, one named Neil Brown and Jackie Parrish. Neil is actually still at CMHS up until recently. I believe that he's still working, although I think he's retired from the federal government. Jackie, they were both young people at the time. They were the facilitators for NIMH of this group called the Community Support Program Section. And they began meeting with early community-based treatment programs to talk about what was the best form of treatment available for individuals. During this time, groups like Project Acceptance in Kansas was funded by a woman named Sue Budd. Jay Mahler, who's still active in the Mental Health Consumer Concerns, which is part of the California Consumer Network of Patients, and the Mental Patients' Rights Association, founded by Sally Zinman in Florida. The Vermont Liberation Organization, founded by Paul Dorfner in Vermont. These organizations were all fighting against what they saw was oppression in the system, but Neil and Jackie were again advocating that we change the system in ways to actually bring about a broader acceptance of people's ability to get care. Now, during this time, a couple of things happened, is that a number of us early advocates in the late 70s and early 80s began to get aware that the Community Support Programs branch was meeting in Washington, D.C., and a number of folks began going to protest that they were talking about us without us, and how there they began talking about us without us and saying that they knew what was right, when some of us were quite capable of speaking for ourselves. Now that actually came about as a result of a lot of work. Rosalind Carter actually chaired the President's Commission on Mental Health. And her basic premise was they called for basic community support. And so Rosalind, again, expanded the concept of the Community Support Program branch of NIMH and their ability to begin thinking about serving people in communities rather than institutions. In 1978, kind of the Bible for the patients movement was written by a woman named Judy Chamberlain. And this is Judy before she passed away. Judy wrote a book called On Our Own, Patient-Controlled Alternatives to the Mental Health System. She didn't invent the concept of On Our Own. She actually wrote about a group that she saw in Toronto, Canada, that still exists today, that's called On Our Own. This is a group of patients that got together outside the state hospital to support themselves in living outside the state hospital. They exist to this day, and she wrote about, in the book On Our Own, Patient Alternatives to Care, how they organized and formed themselves. That book became the basis for my own experience in helping to get started the first publicly funded drop-in center in the United States, which was funded in Baltimore, Maryland. And I'll highlight and show you that. But it was really based on that book that a number of us began reading some of the early things about, so how can we get better ourselves? What can we do to learn about the system, and what do we need for our own care and alternatives, and how might that play itself out? Another pivotal individual in the early movement was Wade Blank. And Wade is the founder of ADAPT. Many people know ADAPT because of their radical advocacy around rights for people mostly confined to wheelchairs, although not exclusively. And Wade actually in 1978 held a public bus hostage at the corner of Broadway and Colfax in Denver, saying that the right to transportation was a right that all citizens of the United States have. And they actually held the bus hostage for quite a while. That later became the ability for the American Disabled for Attendance program today, which is the ADAPT sort of mantra. ADAPT in its early years actually took out sledgehammers and acts of civil disobedience, used the sledgehammers to break out curbs, to create curb cuts so that people in wheelchairs could actually get on the sidewalks. Because with curbs, you can't get on the sidewalk. And so what we now accept today, where we have curb cuts everywhere, people like Wade became the forerunners of creating that. Also in 1979, a new organization for families actually was created. A woman named Harriet Shetler was one of the first founding members of NAMI, the National Alliance for the Mentally Illness, in Madison, Wisconsin. Harriet brought together a group of advocates that included people from around the country to think about how families could get together. And the earliest family organizations were not exclusively for just family members, but also included peers. And so their offices in NAMI were almost always, in the earliest years, staffed by people with psychiatric disabilities themselves as part of the advocacy for the movement. In various states today, we've splintered into factions and so that we don't talk to each other. But in the earliest stages, NAMI and peers often work together to create housing to get out of hospitals. And many of the housing programs in most states around the United States today were created by some of the earliest family groups that came together and said, our loved ones need housing, let's create an opportunity for them to get it outside of a psychiatric center. One of the pivotal federal laws came about in 1980. This is a law that the federal government used to sue states for now. Congress passed the Civil Rights of Institutionalized Persons Act, often abbreviated CRIPA. And CRIPA is the federal statute which gives the federal government the right to come into any institutionalized setting if individuals are institutionalized there and they believe their civil rights of the patients are being violated. In 1980, some of you will recognize some of these people. The Mental Patients Alliance of Central New York was created and led by a gentleman named George Ebert. George is on the far right of this. George was actually one of the early pioneers in the movement, and so this is years later. Back in the day, George and I both had hair and regularly would visit the CSP, the Community Support Programs meetings, and advocate with people like Joe Rogers and others that the community support program should include people with lived experience as part of the dialogue about how we should be treated. And it was years later that Neil Brown and Jackie Parrish invited us in after we protested, disrupted, got arrested a number of times, disrupting the meeting process, invited us into the meetings to sit and view the meetings. We weren't permitted at the table or to participate in the first meeting. And then they realized that that was a problem because we disrupted the meeting. And so the next year they invited a couple of us to actually sit at the table and speak from our own voice what people in psychiatric services needed. So George was one of the early, you could call him a radical, but back then families and patients were all radicals about changing the way the system. So when families say, well, they're just radicals, you have to remember that the early family pioneers were also radicals in creating housing opportunities and support programs that never existed before to actually help their loved ones get out of hospitals when the clinician said you can't leave. NARPA, the National Association of Rights and Protection and Advocacy, was created in 1980, and that actually has gone on to be the primary protection mechanism for individuals with psychiatric illnesses around the United States. In 1980 also, the APA expanded the DSM 3 to now include 224 diagnoses from the original 112. And so also in 1980, a new law was created as part of Social Security reforms, which for the first time recognized that Social Security had a role to play in helping people go back to work. That the federal government recognized that individuals who were on SSI or SSDI had a variety of disincentives when they thought about returning to work. So a section of laws called 1619 were passed, which actually created the work incentives that exist to this day. Many people to this day are still unaware of the work incentives that exist, but these work incentives have existed since 1980. So 32 years later, we're still learning about these things as if they're new. And so I would ask all of you, how many are aware, and you can't do a show of hands, but how many are aware of things like 1619B, IRWIs, PASS, the various work incentives that exist? Most of us are not. And more sadly, most of the treating partners who work with us are not. So as advocates, this is something that we may want to put on our plates as we think about this for the future. In 1981, a new program was created, and this was actually fundamental in establishing more NAMI and peer groups around the United States, which was Public Law 97-35, the Omnibus Budget Reconciliation Act of 1981 created state mental health block grants. And those block grants ended up a few years later being used to finance peer and family groups around the United States and actually expand NAMI and peer groups across the country. In 1982, there was a Supreme Court, another decision that resulted from a Rogers versus Mock case. This came from the state of Massachusetts, in which individuals with psychiatric disabilities were actually permitted to refuse treatment. And so as we think about the Mock case, it said for the first time that a psychiatrist just can't order you treatment, that the patient has the right to refuse with certain caveats. And so that Supreme Court case set that right henceforth and forevermore. One of the early peer advocates, easy for me to say today, Ted Chablinski, actually advocated in Berkeley, California for a change in the statute that the town of Berkeley banned shock therapy. Now, that's not quite as radical as it sounds because the town of Berkeley never does shock therapy. They don't have a psychiatric hospital that they operate. But within the basis of Berkeley, California, electroconvulsive therapy is actually banned in the United States as a result of Ted's work. In 1983, Wade's work actually created ADAPT, and actually you can see Wade and others here are holding a bus hostage to actually look at the demand for accessible transportation in the United States. A number of changes were going about at this time, and as a result of the community support program and the advancement of many of us advocating there began to get formed a number of peer advocacy organizations, including groups like the California Network of Mental Health Clients, founded by Sally Zinman. Sally actually ran this as one of the two independent centers in California at the time to actually bring about a fundamental change in how organizations began to advocate, so that people in that day actually began speaking for themselves. In 1983, the first publicly funded drop-in center in the United States was established in Baltimore, Maryland, On Our Own, Inc. And so On Our Own, in the town that I come from, a number of us got together, established in what is now these blue awning sections of a row house complex, a drop-in center for patients to come to who have been discharged from hospitals to get support in living independently outside of the community. That has now grown to more than 1,000 drop-in centers across the United States, some operated by professionals. As part of New York State, we have a number of professionally operated drop-in centers. In most states, when you talk about a drop-in center, you're talking about a peer-run alternative. In 1984, an advocate for the informed consent around electroconvulsive therapy began a push for an organization called the Committee for Truth in Psychiatry. It was organized as a result of survivors of electroconvulsive therapy. These are people that were given ECT, sometimes without anesthesia, sometimes extensively, sometimes without any care or rest or other considerations. And they began, as a result of Linda Andre and others' work, advocating for changes in the way ECT was administered and informed consent around ECT in a variety of ways. The next individual is a gentleman that some people have heard about. He's won a number of awards nationally, including the National Mental Health Association Award. Joseph Rogers from Pennsylvania is one of the founding members of Project SHARE and the National Mental Health Consumer Self-Help Clearinghouse. Joe was actually, up until recently, the president of the Mental Health Association of Southeastern Pennsylvania to begin a change in that. And the Patients Project is actually a project of the Mental Health project operated by the Mental Health Association in Pennsylvania. In 1984, Congress also passed a set of laws for children called the Child and Adolescent Service System Program, CASP, which created for the first time a basis by which children receiving mental health care and treatment would begin getting their care. So I said that many of us have been around for a long time and been leaders in doing this, and a number of peers throughout New York State are aware of the Alternatives Conference, which was held here in New York and Buffalo fairly recently. What you may not be aware of is the first Alternatives Conference was held in Baltimore, Maryland. Most of the early conferences were held in colleges because, quite frankly, we could get cheaper rates there. And the name Alternatives was coined by a gentleman named Mike Finkel, who said we really should be looking at not replacement necessarily for the mental health system, but what alternatives can we find for ourselves that would lead to more humane and care and treatment. When we talk about housing, one of the earliest advocates for a different kind of housing is the Collaborative Support Program of New Jersey. CSP of New Jersey is a peer-run program. It is arguably the largest peer-run program in the United States. They have a multi-million-dollar budget that is quite large, and they actually operate the largest consortium of housing from a peer-run entity in the United States. Jack Boucher, who's seen here, actually started bringing people together to build drop-in centers across the state of New Jersey that were peer-run and managed, as well as to begin creating peer-operated housing. So the housing in New Jersey is not operated by mental health programs, but is actually operated by a peer-run program, CSP of New Jersey, that actually creates a difference. In 1986, an organization was founded called the National Empowerment Center. And here's Dan Fisher. And Dan is most noted for being part of the President's New Freedom Commission report a little bit later. But Dan is actually a psychiatrist who, in Dan's words, has recovered from schizophrenia. Dan was diagnosed with chronic schizophrenia, went on to complete his medical training and education, and is now a community mental health center director in the state of Massachusetts, as well as the director of advocacy of the National Empowerment Center. Now, a lot of things have changed over the years, and one of the things that changed primarily is a law establishing the creation of rights for people with mental illness. I told you the DD system did it before us. In 1986, Public Law 99-319 was established after the DD Act. That's the way it was modeled. That actually created legal rights for patients who were institutionalized. And this created programs like in New York, the Mental Health Legal Services, which provides free legal representation if you're institutionalized and provides an oversight body to oversee and investigate abuses in psychiatric centers. 1986 also brought about major changes with what was called Public Law 99-660. Public Law 99-660 created the Comprehensive Mental Health Services Act. The law actually for the first time required families and peers to be on state planning councils of every state in the country. So 99-660 has now been replaced by Public Law 102-321. The sections of law refer to the Congress and section of law that created it. And so these laws require, it's not an option for states, they require that patients and family members be part of the state boards which oversee the planning for state processes. Now, we often think about, and I heard several people talk about certification from Howie the Harp or being certified as a peer mentor or case worker. The first peer certification actually came about as a result of a gentleman named Pat Rizzer in Colorado. And Pat actually created the first consumer survivors training to work as a mental health systems professional in Denver that were actually billable under the Medicaid rehabilitation option waiver in Colorado. And so he actually created the ability for peers to work and get paid for working in the mental health system by virtue of his work then. The individual who is most cited with recovery outcomes and responsible for publishing the longest study called the longitudinal study on mental illness and recovery is a lady from now New York State, Courtney Harding in 1987, published, hang on just a minute,
Yeah, I think
we've
I booted off.
timed out here, so we'll reboot ourselves in just a sec. So I think we're okay.
Yeah, looks like we're back on.
Okay, so Courtney Harding is someone who's known in New York State. She now works in New York City. She published what's called the Vermont Longitudinal Study. This was after the closure of the Vermont State Hospital. They followed up on patients who were discharged. Many of these patients had spent decades in the hospital. And in the study, it's often cited that they found that a third of the patients got better to the point of not being diagnosable as ever having a mental health issue. That there was no sign of ever having a mental illness. A third of the patients got better. So now we're talking about 2/3 either became completely well or got better on their own. And a third of the patients stayed the same or got worse. So only a third of people in care stayed the same or got worse, which means some of the myth that many of us as family members and peers have been told for years about mental illness chronicity and you'll never get better and it's hopeless and the best that you can do is hope to get where you are is absolutely false based on the Vermont Longitudinal Study. Fully 1/3 of the people in that system, 30 years later, when they went and found them, they found virtually almost everyone,
a minimum number of lines are connected.
were found that they had no sign of a mental illness in spite of having spent decades in state hospitals. Pretty significant finding of the day. So Courtney is part of the Vermont Longitudinal Study. In 1988, actually became the first of offices like the Office of Consumer and Family Affairs in New York. In 1988, David Hilton in the state of New Hampshire was hired as the first statewide advocate staffing an Office of Consumer Affairs with the task of representing people in state policy making. David struggled with his own recovery for many years, And this painting of David was actually based on an early photograph. Is years after David passed away as a result of ultimately succumbing to the demons of his depression and committing suicide. But David was an advocate at the New Hampshire Office of Mental Health for almost 15 years, and it's the longest of the consumer affairs offices in the country. 1988 created the Civil Rights Restoration Act, which made it illegal for any program, regardless of whether or not it was receiving federal funding, to discriminate on the basis of disability. President Reagan overrode or vetoed it. Congress overrode his veto in 1988. Also in 1988, the CSP, remember the branch that I told you that Joe Rogers and myself and George Ebert and others protested, actually began creating what were called demo fund projects, and actually began funding consumer and family programs around the country starting in 1988. This is actually the financing mechanism for many of the earliest peer-run programs around the country was through the CSP. The NAMI Consumer Council was also created that year and headed by a gentleman named Tom Posey from Montana. Tom is now a statewide advocate in another state. But NAMI recognized that for the first time that it actually needed a different mechanism to ensure that recipient voice was being heard in its deliberations and meetings. In 1989, the Parent Support Network was created in New York State, and it actually created the opportunity for New York to hire parent advocates of individuals with behavioral and emotional disturbances to actually help advocate for young people in the New York State system, and the Parent Support Network was formed after that. 1989, those of you in New York City and elsewhere around the state may recognize this woman, although she looks a little different today. Celia Brown was actually a part of working with a woman named Mandy Blanche, who was working at the Office of Mental Health at the time, actually created the first peer specialist in the civil service title in the United States. Celia was hired as the director of peer specialist and has been a long-time advocate. And so I'm very pleased that Celia both was instrumental in our history, but has also been a long-term friend and colleague. In 1990, as many psychiatric hospitals have done, we had more than 500,000 people in 1955 in hospitals. By 1990, we were beginning to get the census down, in part because people were now living in community programs that were financed by offices of mental health. 1990 came the closure of Bryberry State Hospital in Philadelphia. And this was actually closed and considered one of the great closures because it brought about a fundamental change in the way we thought about financing and the way we began to think about state hospitals as only for acute care rather than long-term care, that long-term care should actually be delivered in the community. Now, many of you will recognize this picture. In 1990, the Americans with Disabilities Act was passed, and on the far right, in the wheelchair with the hat, is a gentleman named Justin Dart. Justin was actually, before this, the head of the Federal Rehab Services Administration, and he was actually fired from that job because under President Reagan, he actually told Congress that people with disabilities were not being treated equally.
Terrible.
And so Justin actually advocated for the passage of the Americans with Disabilities Act. And I have to tell you, as an individual who spent a number of days at his duplex in Georgetown with he and his wife when we were advocating for passage, Justin single-handedly fought for the inclusion of chemical and psychiatric disabilities to be part of the Americans with Disabilities Act. Without his insistence, mental health would have been taken out. And so Justin was a great ally for many of us, in that he stood up to the other advocacy groups for physical disabilities and said that he personally would not support an act that did not include mental health and substance abuse as part of it. And so Justin and his wife actually held a number of receptions after we'd spend all day on Capitol Hill talking to legislators to try to get them to pass the act. And here you can see the first President Bush signing the act into law.
Was he involved during Reagan's administration, Justin?
As I said, Justin was the head of the Office of Rehab Services, and Reagan fired him because he spoke out about the treatment of people. Gail Bluebird is considered the mistress of the arts in mental health. Gail is a civil rights advocate from Florida and actually instrumental, along with Howie the Harp and Diane Cote and Sally Clay, in creating something called Altered States of the Arts. At the National Alternatives Council, Gail advocated that sometimes people with psychiatric conditions see things so radically differently that they create art which is so profound and different that is in fact a benefit rather than a deficit. And so Gail to this day is most noted. Whenever you see her, you'll see her usually with a chapeau, although sometimes she wears a variety of other hats, advocating for the arts in terms of, as part of mental health advocacy.
What was her name?
Gail Bluebird. Here's a gentleman who has fought tirelessly for the civil rights for people with mental health conditions, although sometimes he's been vilified depending on how you look at him. David Oakes is part of what was originally called Support Coalition International, now called the Mind Freedom Association. David, like many of us, I remember the first time meeting David, George Ebert, and I were all handcuffed together at an APA convention, protesting a number of the diagnoses which have now been removed from the DSM, which were more about controlling individuals rather than about an actual diagnosis that the APA thought was treatable. Parent advisors in 1991, the Office of Mental Health actually created the first parent advisors in many of our offices. So 5 parents were hired as regional parent advisors. This was one of the award ceremonies from years later. And at the Alternatives Conference in 1991, which was held in Berkeley, California, a new branch of the consumer movement was actually created called the Fruit and Nut Bar for people who were gay. And euphemistically, they said, well, we know we're all fruits, but we're also nuts. So we think the Fruit and Nut Bar is appropriate. And so as advocates, they chose a little bit of humor. In New York State at the same time, Sally Clay founded the organization People, Inc. that Steve Michio now heads in Poughkeepsie, New York. And a gentleman named, I'm going to draw a blank on his name, and I put notes for myself so that I would find it, actually came out at that Alternatives as Miss Altered State of the Arts to make a point of the APA's former prohibition against individuals cross-dressing. So Mark Davies is his name. No, it would take me a minute to think about it. So Mark came out as Miss Altered State of the Arts at the Alternatives Conference. Homelessness has always been an issue around mental health care and treatment. And so a number of us have been advocates on the homeless front as well. In 1982, the Federal Interagency Task Force on Homelessness came out on the report Outcast on Main Street, which was considered the #1 report on homelessness and mental illness in the United States. If you ever take a look at the report, you'll find my name in there as one of the advocates, one of 2 peer advocates that was named by the President to the Interagency Council at that point in time to advocate for our issues, particularly when we were thinking about homelessness. Also in 1992, Celia Brown established the first People of Color Caucus at the National Alternatives Conference. And this later became the growth of the network of people of color who are mental health consumers. People of color have always been treated differently in the mental health system in a variety of ways since the Civil War. You would think we would have done better in that regard. But even to this day, most drug research excludes African Americans from drug research trials because their biological makeup is slightly different in absorption of chemicals and things like white blood cell counts. And so that they don't get exclusion for certain groups. They generally exclude people with the most severe illnesses, and particularly African Americans. Until recently, they excluded females as well from drug trials.
John?
And so I'm going to ask that we hold questions till the end, only because not all the sites have the opportunity to ask questions. And so if in this room you ask them, it disrupts the flow for the other sites. In 1992, the Substance and Mental Health Service Administration was founded. This was a breakout of several different organizations. Adam Ha, which is its predecessor, the Alcohol, Drug, and Mental Health Administration was created. Public Law 102-321 came about in 1992, and SAMHSA is part of the agency that oversees the Center for Mental Health Services that exists today. Also in 1992, we founded, as part of the advocacy of offices of consumer affairs that exist in the country, the National Association of Consumer Survivor and Mental Health Administrators. Larry Fricks, who's most noted for a number of things, was one of its founding members. I currently serve as the president of this body. This is the organization that has fought for restraint and seclusion reduction. And in fact, for 5 years before groups like NAMI and others came on board, a woman who worked for us through NACSMA, Joyce Jurgensen, actually had a contract with the federal government to look at restraint seclusion elimination in the United States. And so NACSMA is an organization that you don't hear of because it's not out in the public arena, but privately, the offices of consumer affairs from around the country get together and join our voices to advocate for things like the morbidity and mortality study that NASH also did. In 1993 was another thing, and I only bring this one up because it's listed in some of the history books about the history of mental health services. In 1993, they used to hold the Community Support Programs branch meetings, where they'd invite grantees from all over the country in. Was consumer leaders, family leaders, Native American leaders, and others were invited to a national conference to talk about their issues. At this conference, Dr. Ahrens, Bernie Ahrens, who was the head of the Center for Mental Health Services, it was his first day on the job. A number of us, myself and Darby Penny, had been hired to actually facilitate one of the breakout groups at this session. And on the first day, we heard from a singular speaker, Lori Flynn, who talked about NAMI as being the only legitimate voice for anyone with a mental illness. Now, not that any of us would object to NAMI being a voice for families with mental illness, but to be the only voice was something that we could not tolerate, because those of us who have lived experience were physically there. Native Americans were physically there. And so late that night in the bar, I wouldn't say after too many drinks, but I didn't drink alcohol at the time and still don't drink very often, we decided to stage a protest. And on the following day, I led a walkout of 50-some delegates to this convention. We went to the Center for Mental Health Services, and we occupied Dr. Ahrens' office. The demands at that day were that people be allowed to speak for themselves, and that no organization should represent anyone except those who were members of that organization, and that everyone else should be permitted to speak on their own behalf with their own voice. The Native American communities from the western states joined us. We spent all day with Dr. Ahrens, who listened and agreed to our demands. That protest actually resulted in the creation of the first Office of Consumer Affairs at the Center for Mental Health Services. Now, protests can be a useful tool, but they also have a bad side effect. In this particular protest, one of our great advocates, Jackie Parrish and Neil Brown, were kind of ostracized and banned to the hinterlands for bringing radicals to D.C. and allowing us to take over part of the office. Ever since then, the radical leaders of the consumer movement have never been invited back to Washington, D.C. or the metro area in any measurable number because of fear of events like this. But the event had great power. The Alternatives Conference was held that year. There were a number of other meetings, and we actually began a series of meetings that led to the creation of many of today's consumer and family events. And so Lori Flynn, a great leader of the family movement, still was a recognized spokesperson, but to say that only she could speak on behalf of anyone with a mental illness was what we objected to, not to Lori herself. Some people know Peter Stasny. Peter is a psychiatrist who worked for the Office of Mental Health for a number of years. In 1994, the regional recipient affairs offices were established around the state. Darby Penny, Celia Brown, Peter Stasny, and Neil Cavada were all hired, and some of you know some of those leaders. In 1995, a little over a year after the walkout at CMHS, CMHS hired its first director of consumer affairs. They hired a consumer affairs specialist named Paolo Del Vecchio. I am so pleased today to report to all of you that Paolo Del Vecchio was named by the president as the new administrator of the Center for Mental Health Services this year. Paolo is a peer and was hired as a peer as a result of the protest. Now heads the very agency which would not allow peers to speak for a period of time. 1985, we're talking about managed care today, brought about the Managed Care Consortium, which a number of us, again, were invited to speak at. Having been a state managed care director in the state of Maryland, where I actually managed the mental health part of managed care system for Medicaid and was the state Medicaid director, I was invited as one of the principal and keynote speakers and spoke to a delegation of more than 200 peer and family members around the country. You'll find a number of important things written and published in this book, Managing Managed Care, as well as a chapter written by yours truly about the benefits of managed care when it's done right. And managed care is not necessarily a bad thing. It can include funding for peer and family services. 1985 in New York also brought about some notable people. Ike Powell and Sharon Carpinello, former commissioner of the Office of Mental Health, began publishing their mental health confidence scale, and those are still used to this day. Also in 95, Howie the Harp passed away, and Howie was most noted as one of our peacekeepers and mediators in the consumer movement. 1997 brought about Mary Ellen Copeland's RAP planning, Wellness Recovery Action Planning, that many of you are aware of and familiar with, and RAP planning today is considered the standard. Trauma and abuse in 98 was particular, and we began recognizing women's abuse in the mental health system through the trauma-informed network of care. That has dropped out of favor and has now come back in resurgence because now we're recognizing that trauma affects not just women, but that many males are also affected by trauma and have traumatic histories of abuse in the mental health system and elsewhere. We're almost near the end of this, and so we'll break in just a couple more minutes, but I want to set the framework for our discussion. 1999 brought about the Olmstead decision, and Olmstead was really about Olmstead versus LC or LC versus Olmstead. Here are the two women that the Olmstead decision with their advocate Sue Jamison was about, Elaine Wilson and Lois Curtis. They're from the state of Georgia, and Larry Fritz's wife, who you saw earlier, was also one of their advocates and helped advocate that their case go to the Supreme Court. And their case simply was they shouldn't be held in a psychiatric hospital because the state hasn't built housing for them. And so instead of the least restrictive setting, the Supreme Court Olmstead decision became about the most integrated setting, requiring states to provide care in the most integrated setting possible. 1999 also came about the Surgeon General's report on mental health, and this was a decade later after Rosalind Carter's report. And it actually, in the Surgeon General's report, you'll find self-help, peer and family support rated and listed as evidence-based and best practices. So family and peer support's a best practice. 1999 also brought about the Ticket to Work program, which actually created incentives to help people think about returning to work and to do so in a way that was meaningful and for them. 1999 brought about the Healthcare Finance Administration's interim final rule on restraint seclusion. I mentioned that NACSMA had been fighting for legislative changes. We were effective at working with HCFA, which is the financing mechanism for all hospitals, to finance major reforms around restraint and seclusion. The year 2000, when you think about healthcare, brought about a set of literature review by a woman named Ruth Ralph, who is a noted peer researcher who brought about the review of the literature about recovery. 2000 also brought about the National Council on Disabilities, promotion of from privileges to rights. This was really a first discussion about how to help move from just getting privileges to actually having rights and being a pivotal part of the transformation of the system. 2000 brought about the Children's Health Act, which I hate when I have a senior moment. Our current Director of Foreign Affairs, Hillary Clinton, brought about as part of the Clinton healthcare reform package, the Children's Mental Health Center right came about creating that. And 2001 brought about something that still to this day not a lot of people take advantage of, are individual development accounts. These are what's called match savings accounts, where if I put $1 in, I can get as much as $7 other matched to it to do things like buy a house or go about creating opportunities for me in other ways. 2002 brought about the white paper on consumer services that many of you know about. Amy Colasanti was instrumental in helping to educate about. And then 2003, of course, brought about the President's new Freedom Commission report. Rosalind Carter, in thinking about the difference between 1993 and 2003, recognizes that the difference in those 10 years was that in 2003 we recognize and know that recovery from mental illness is real. And those are Rosalind's words, not mine. And so you recognize the commissioner, Dr. Hogan, was the chair of the new Freedom Commission report in that year. Lost Cases, Recovered Lives was a part of the suitcase exhibit that Darby Penny and Peter Stasny created as part of the process around looking at recovery. And in 2004, the Center for Mental Health Services created the consensus statement on recovery. What's the definition of recovery? 2006, NACSMA again came out and passed a motion that we should establish a national memorial for people with psychiatric disabilities and those who died in psychiatric hospitals. That memorial has begun and is on the grounds of the St. Elizabeth's Hospital outside of Washington, D.C. And again, it's a group that you don't often hear about because we're not public. We don't go out and advertise what we do. But I'm very pleased to be the president of an organization that would recognize people's dignity after they've died. Equally important in 2006 was the Nashville Medical Director's Report on Morbidity and Mortality. It's this report that shows we die 25 years prematurely. Again, you'll see a couple of consumer advocates and only one consumer present at the meeting. As part of the Nashville Medical Directors Council, I'm the only consumer in the country who is seen as an equal with the medical directors of all of the states and the other parts of the country, and I've served as a writer of many of these reports. And you'll find my name and a lot of quotes from me written about how we should go about changing and including peers and families in many of these responses. In 2007, we named Larry Fricks, was able to advocate, the Center for Mental Health Services named peer services, including family support, as an evidence-based practice. And in 2006, we also looked at the SAMHSA's Wellness Summit to begin advocating for changes in healthcare delivery. This is Dr. Joseph Parks, who is the head of the Nashville Medical Directors Council. I'm very pleased to call him a friend and colleague, and Joe has been an advocate for our inclusion in a lot of ways. So here's the questions to frame before us as we get ready to break for lunch. We've got some challenges ahead of us, including what we do for work, life, and home for peers. And as we think about this, I want you to think about the advocacy that's gone on over the last 200 years and the advocacy that we should be doing now for the next 3 to 5 years. I want you specifically to think about medications and to think about the effects and what are we going to do about medication in terms of getting medications that are either more helpful and eliminating the medications that are harmful. We've been working to eliminate polypharmacy in New York State, which causes some of that 25 years lost life, and how do we go about doing that? We're also going to be faced with managed care. And so what do we need to advocate around managed care to think about what needs to be done to ensure that peer and family services continue to exist in a managed care financing environment? And equally important, what are we going to do about forensics? Those of our loved ones who are involved in the criminal justice system, and what kind of advocacy do we need to support those individuals who are often confined behind the razor wire and not able to speak for themselves? We often talk about housing as being a critical issue, but yet many of our peer and even our family groups continue to not have housing as the #1 agenda on their advocacy platforms. And yet when I talk to families and I talk to peers around the state and around the country, housing is the #1 issue, stupid. And so how do we think about it, and what as a group do we want to begin advocating around when we think about housing and housing rights? We at the Office of Mental Health have begun advocating around transportation assistance, and I'm very pleased that Tony Trahan has been my chief architect in working with our Department of Transportation to begin thinking about how we think about transportation, not just to and from medical appointments, but to and from employment opportunities is critical in the world of transportation. And equally important, how do we think about a meaningful role in society? That role of being an employee or a volunteer, doing something that's meaningful for ourselves, as well as building economic independence for our own lives. How do we establish having a group of friends to be able to reach out to and partner with, to enjoy life with, and to socialize, who are not friends just because we all go to the same mental health program or live in the same mental health housing, but are truly friends that share common experiences. And out of that group of friends, how do we look to find the one significant other for which I may have a relationship with? We continue to this day to still have some of the vestiges of eugenics, where we don't allow people to get married and we don't support housing for married couples who have a mental illness. And in New York State, we still have laws that say it's difficult for you to have a child if you have a mental illness because we can take the child away from you. So what kind of advocacy should we be doing around that as we think about the future? So the questions I'm going to ask you to think about after lunch are, where do we go from here? Which direction do you want us to go in around these or any other issues that are concerned to you? And I want to frame the thinking as you think about the dialogue for after lunch to the great quote by President Kennedy, who's been changed a number of times in a variety of ways. I want you to think about and dream about not things as they are and asking why are things this way, but I want you to dream about things that don't yet exist and ask why can't we create them. So with that, at all the sites, we really don't have time for questions. We can do that some later, or we'll actually do this in another format to allow more dialogue afterwards. Let's break for lunch. Think about what you want to advocate for based on the experiences we've talked about today and based on any other experiences that you've had. And for site facilitators, think about the questions of what do you want to advocate for as you break for lunch. Take your natural breaks. Let's come back together at 2:30, which will give time for lunch and your breakout. And so we'll ask for a report on the breakouts at 2:30. For those of you at the sites, leave your video up, and you can disconnect the webinar if you like at this point in time. So we'll see you all back at 2:30. Thanks so much.
Make sure that I get the right phone number though, okay? Because you should be able to get in.
Sure, I'm just gonna
Correct. Yes.
Okay.
I'm not sure how you get out there. How you get an external line. So I don't know how. Yeah, you probably need to get an outside line. I don't know if that's 9 or 99. And then 8.
The reason is a funding issue and a political issue.
All right, I got it because I've got it running now, so we should be
Start
okay.
better. No
All right,
politician wants
but
to-
we're going to be breaking for lunch right now, so I wouldn't call in
And the reality is,
until after lunch. So,
it's the one
okay.
area of paranoia
All right.
that the public has, that they want people to walk away. And so the Office of Mental Health is trying to balance what the governor and the public wants with what we think is the least restrictive of all the things that we could do. Now, it's obviously not the least restrictive, but in this political climate, it's all about politics. It's all about who votes and who doesn't vote.
They've had I wish there was some way that I could go around telling people what I've learned and how I've changed.
Well, maybe you can, and maybe there's some things that we can do for the SOPT units that we've done for the other forensic units. Let me think about that and think about and talk to our forensic coordinators. Maybe there's a way that we can look at creating a support mechanism for folks like yourself on the SOPT.
I'll take a look at that.
So take a look at it and see what we can do.
Okay, thanks very much.
Yeah, thank you. Cool, so bon appetit for folks that are here.
I already appetited, but
All right, appetited? Maybe you can appetit again with us.
I was telling Debbie, I came here, you were only up 1983, and I thought I wasn't gonna wait another 29 years.
Probably a wise idea.
So, John, I moved it over to this slide for people. So just kind of,
Good. That's great, because that's the right question.
Tony, I have the receipts for lunch too. I'll copy you the attendance sheet, and I'll give you the receipt and everything now. And we'll-
Okay.
we'll be all set.
Can you make a copy of
Probably
the
want to keep a
receipts?
copy of the receipt
Oh,
here,
yeah.
just in case.
Oh, yeah, I always do. Yeah, I always do. Yeah, I usually always keep a copy because then I keep it with the rest of my stuff, you know.
It's interesting putting it together. It reminded me of a
Yes,
lot of-
I know.
it reminded me of a lot of people that-